Hello and good morning, and welcome to Young Lung Cancer Initiative's patient education series on surgery with lung cancer as a young onset lung cancer patient. Today, we will have various stages of patients, different types of surgery, some with complications, some without, some traveled, some did not. So, we're going to cover a lot of bases. This is going to be one episode of a three-part series. Each episode will have a different feature. Today's first episode will be about all the information you need about before surgery. So, how do you get approved? Who do you talk to? What questions do you ask? The second episode will be on the actual surgery itself. And the third will be on what about after surgery. How is recovery? So if you are interested in learning more, make sure to like and follow us so that you will have easy access to the remainder of the episodes. So to get started today, I'm going to introduce myself and then I'm going to let my friends that are with me introduce themselves as well. So my name is Leah Phillips. I am the co-founder of Young Lung Cancer Initiative. I was diagnosed stage 4 EGFR exon 19 deletion in December of 2019. At the time of diagnosis, I had my primary tumor was in my right middle lobe and I had 13 bone mets between my pelvis, spine, and ribs. I started Tagrisso in December of 2019, and I'm currently still on Tagrisso at this point. I had 8 sessions of SBRT, which is a very precise, high-powered radiation to my primary tumor in December of 2020, which makes me a little bit unique in this crowd. I think I'm the only one to have had radiation prior to surgery to the lung, at least. Then in October of 24, I had a right middle lobe lobectomy with Dr. Antonoff at MD Anderson. So I did travel from home. I had to fly to and from surgery. So that's kind of a little bit about my perspective. And at this point, I'm going to turn it over to my friend Lexi to introduce herself and kind of tell you a little bit about her story.
Hi, everyone. My name's Lexi, and I am a stage 4 lung cancer patient. I also have EGFR, but I have a exon 20 insertion mutation. I was diagnosed in November of 2023, and I have metastases to my T10 vertebrae, my left hip, and my left femur. I found out that I had cancer just because I had severe leg pain. My left leg the bone was almost completely eroded. When they found it, I first had surgery to stable my leg, then chemo, then radiation to my leg, not to my lung. And then I had chemo, targeted therapy, oral drug trial, and tried a myriad of things until we decided to go for surgery to remove the primary tumor in my upper left lobe. I did do a RATS Da Vinci procedure, which is a robotic procedure where they there are several small incisions to the body, and a scope is inserted along with instruments through tubes, and it's similar to laparoscopic surgery, but the surgeon controls the instruments through a control panel as opposed to manipulating them directly himself. So that's a bit of a background about my story with surgery, and I'd like Ashley to talk about her experience.
Thanks, Lexi. So, similar to Lexi, I had a RATS procedure as well, also on my left lung, but my lower lobe. I was diagnosed with lung cancer in September of 2024 with a ROS1 mutation, stage 1, and I had a 2.7 centimeter tumor. And so my surgery was curative intent. So right now I'm currently in remission and being monitored by scan. So I have not had any additional treatment at this time and had the surgery in October. And I would like to introduce Haley.
Hi, my name is Haley. I was diagnosed with stage 4 EGFR 19 deletion mutation in September of 23. My primary tumor was left upper lobe, about the size of a golf ball with possible pulmonary artery involvement. I had nodules in both lungs, multiple. I also had metastasis to my left scapula, my pelvis, and possible occipital lobe. And I also had a malignant pleural effusion. I live in Kentucky, so I traveled to MD Anderson for second opinion. I also started Tagrisso 80 milligrams once a day in October of 23, right after I was diagnosed. And in March of 24 was whenever I had a PET scan done at MDA where it showed complete metabolic response. So I met with Dr. Antonoff that day at MDA, and we scheduled surgery for May 10th of 24. So I had top pleurodesis done then, and I'm still just on Tagrisso. I'm going to turn it over to Mariah.
Like Haley, I'm stage 4. It was also diagnosed September of 23, 19 deletion. I had been dealing with what the doctors thought was pneumonia for 6 months and went back end of August. Turns out I had a collapsed lung and was hospitalized for 11 days. And they found the cancer, malignant pleura. My spine was lit up like a Christmas tree, pelvic area, and also a met in my brain. Tagrisso took care of the brain met. I was immediately put on Tagrisso, but also chose to add chemo, carboplatin and pemetrexed based on the FLORA-2 study. Did 4 rounds of the carbo-pem combo and then maintenance chemo, and then was taken off, I think, early and felt, what else do I need to do? I talked to Haley, we'll discuss later, but I found out what she was going, her current state, and that they were moving forward with surgery, whereas my local oncology was like, let's think about that in a few years, but went forward with it, and mid-June went with open surgery, upper left lobe. It's thoracotomy with wedge resection. It's very complex. I will send it off to Terri.
Hi there, my name is Terri. I was diagnosed with stage 4 lung cancer in October of 2021, exon 19 deletion as well, like many of you. And I started Tagrisso a month later, and I've been on it ever since then. So just over maybe 3.5 years now. After 2 years of being on Tagrisso, and I had a great response, I decided to have surgery. So met with Mara Antonoff, met with the surgeon at my hospital, and also met with the Dr. Serfolio at NYU Langone, and decided to travel to New York to have surgery there, where I had a lower left lobectomy, a pleurectomy, and 33 lymph nodes removed. At diagnosis, I had cancer in my lower left lobe, and I had malignant pleural effusion as well. They thought maybe I had cancer in my right lobe as well, but that didn't turn out to be cancerous. So my surgery was, it was in September of 2023. So it's been 1.5 years now since the surgery. Mine was rats as well.
Thank you all for sharing your journey and stories. I guess I should say that there's a third option actually for lung surgery, either removal or lobectomy or a wedge resection. A wedge resection is just where they remove part of a lobe, just really to get out the cancer and leave the rest of the lobe intact. But there is that third option, which is not as common, but it's called VATS with a V, and that just means it's video assisted surgery. So similar to the Da Vinci as the smaller incisions where the camera can go in and get a good look, but the doctor is actually using their hands to work on the surgery. So it's bigger incisions, but not as big as like an open incision that Haley and Mariah and I all had, which my incision is on my right shoulder blade, is probably about 6 to 7 inches long. So this is kind of the in between. And what I've been told is it was kind of like the bridge between open and rats, or the robotic assisted surgery. So now that you've heard kind of where we've been, where we come from, several of us have traveled. Some, I know that Lexi stayed local. So we're going to talk just a little bit about, what do you do? How do you find out if you qualify for surgery? What happens next? So probably all of our stories are a little bit different, but I think probably the biggest thing is just if anybody would like to share, what was your pathway to surgery?
Went for a second, or actually it was a third opinion at MD Anderson in December after I was diagnosed in September. And their big thing from day one was consolidation therapy, whether it was radiation or surgery or a combination of both. So that was kind of always on the table from them, not from my local oncologist, but from them. That was kind of always a goal, was to get to surgery or radiation. So it was kind of proposed to me from day one. And whenever I had that total or complete metabolic response on the PET scan, that day they fit me in with Dr. Antonoff at MDA to see her, to see what exactly my options were, what she thought, how likely it was to be successful. And even if it wasn't successful, she was really positive about at least we would know more from getting to look at it from the inside.
For me, the pleura was still a concern on the scans, and my local oncologist at Duke was wanting to see that shrink more or something change with it. But when I was first diagnosed and working with her, I was under the impression that surgery was going to be talked about sooner than years down the road, because her mentality was have the Tagrisso do its job as much as possible. But the fear of mutation, I just didn't like the idea of cancer just sitting there. And I always was like, hit the cancer with whatever I can. I didn't like relying on just this little pill for when the cancer outsmarted it and then I see there's progression. So it was, I think, very serendipitous that I was talking to Haley when she was scheduling her surgeries and hearing the similarities and how MD Anderson was moving forward. But Duke was like, no, let's just stay on Tagrisso. And so it was up to me I was motivated by Haley to reach out to MD Anderson, and also Bianca she shared the North Star clinical trial and the benefits of that. So I was like, I'm going to push. And it's funny because my local oncology she was like, well, we can offer surgery after all, after talking to surgeons. And I was like, I'm going to stick with MD Anderson, even though she eventually became on board with it. But I'm so thankful that I went with Dr. Antonoff as well, being a trailblazer for all of this. So, but yeah, it was like the pleura, and turned out it was just inflammation due to the talc pleurodesis when I had the collapsed lung. So, and I had like 0.1% active cancer when they opened me up. But at the time when we're discussing about surgery, Dr. Angel was like, if there is active cancer, we can't move forward, but it is beneficial just poking around, seeing inside, seeing what else is there. So I'm very fortunate that I had such a great response of chemo and Tagrisso resulting in no active cancer pretty much.
Thank you. Anybody else want to share?
I would just say for me, the option only was surgery. That's the standard of care for treatment for stage 1, but I still sought out a second opinion. And I feel very passionate about that because even though I stayed local, my surgery was at Froedtert in Milwaukee with Dr. Linsky. I still gained knowledge by going to University of Wisconsin and meeting with a different surgeon that I was able to take back to my primary thoracic surgery team.
Yeah, I think I noticed a sort of almost academic shift in the thinking from the beginning of fall 2024 until to like the beginning of winter of 2024, at least within my oncology team. So I was also on pemetrexed and carboplatin, but then amivantamab in early 2024, and that did bring my burden of disease down quite a bit. And it also was a challenging drug, but I would take it any day given the chance because it did reduce my burden of disease. It was difficult to tolerate. And when we tried a oral drug trial in fall of 2024, my doctor at Northwestern had said, all right, well, here are different options that we could consider. And surgery was her least favorite option at the time, because especially with stage 4, right, you have to stop treatment for a certain period of time. And I'm not on an oral, I'm on, IV therapy. So it's a little bit, more time prior, a little bit more time post for wherein you can take your, treatment to treat the entire body. And it was still like, let's just see if we can continue to try to treat you and reduce the burden of disease without doing surgery so that we can treat the whole body. And at the end of the fall of 2024, it was just more evident that the spot in my upper left lobe was a bit more persistent and stubborn, like myself, and than some of the other spots in my body. And so as when surgery was considered the least favorite option, it was suddenly the one that was recommended. And I think that that was also because some of these other steps forward, which I'm very thankful for, because I did have an additional mutation.
Terri, did you want to share how you got to surgery, or you feel like everybody's covered kind of the same? You felt like your path was similar?
You know, I felt like when I was diagnosed, it wasn't talked about. Surgery at stage 4, I was always interested in it. And had I known about the North Star trial, which was, I believe, enrolling at that time, I would have enrolled if I could have. Did not know about that. I really, once I found out about it, I wanted to do it on my own, do my own trial. And so I talked to my oncologist about it. He was always interested as well, although I don't think he maybe thought it was a great idea. He just saw, hey, there's this drug. It's not invasive. It's very well tolerated for the most part. Let's just do that. And I kept pushing, and I did deep dives into some online communities, you know, EGFR resistors and the Tagrisso group on Facebook. And I just searched everyone that I could find who had been able to have surgery and tried to connect with them. And it felt like there weren't very many of them, but a few did, were willing to chat with me. And my oncologist also knew Dr. Antonoff because she was an intern while he at the same hospital. So he introduced me to her. I flew out to meet with her. The surgeon at my hospital didn't want to do surgery, didn't feel comfortable with that. And then I also didn't feel comfortable doing surgery there if it wasn't something that they were comfortable with. So met with Antonoff. I thought she was wonderful. And then also met with Cerfolio, who was introduced to me through someone online who had had surgery with him, actually 2 people, and raved about him. So I met with him online, video conference, and continued to meet with him, and then ended up just by chance. I really struggled with the procedure to choose. I felt very comfortable with Dr. Antonoff, and a less, Dr. Cerfolio wanted to remove my pleural lining as well, and that was feeling riskier. I happened to meet just by chance a really strange encounter in another country when I was wearing a swimming suit on a vacation, somebody that was an associate of my oncologist, of Dr. Antonoff and Dr. Cerfolio, and knew them very well.
Wow.
And we had a conversation. He helped to kind of guide my decision with everything that was going on with me and my level of risk. So I went with Dr. Cerfolio, and it went well, and I'm cancer-free at the moment. There was never for me any assumption that this was curative intent. No one was telling me that this would be curative, but I did want to do everything that I could that was available to me to extend my health, reduce my tumor burden. I never wanted to get to the point where, I had missed an opportunity that I might have been able to take advantage of at the time. So for me, regardless of the risk, I wanted to move forward with the surgery.
I want
thank you
to
all
add
for
something. Sorry.
Sure.
With that, my local oncologist was always told me, like, she wants me to be as ready for a marathon as I can. I felt, well, having surgery now in my current health would be better than down the road if, I'm not able to recover as quickly after, chemo or whatnot. So I really felt the need to push, like, now. I've, like, before anything else pops, let's just do it now while I'm as healthy as I feel as I am.
Right. I had a somewhat of a similar conversation at MD Anderson. It was a few years ago, back before it felt more common to have lung cancer surgery at stage 4. I can't remember the name of the oncologist that I met with, but she was very on the fence as to whether I should have surgery because she wanted me to have 2 healthy lungs should I advance. Dr. Antonoff was willing to do the surgery, but there was still a hesitation, even at MD Anderson, as to whether this was advisable back then.
I think that's an interesting of finding the right balance of where you are with your burden of disease and with the, team and of doctors that you have, and with the types of treatment paths that you're on. I think those are all really important factors to determining like when is the right time, for you and to talk about that with your oncologist. I mean, I love my doctor at Northwestern, Dr. Patel, and the doctor who removed part of my lung is named Dr. Lung, and that's his name. And he's wonderful. And I felt very fortunate that I had the option. I said to her, I said, who would you go to if someone was taking out your lung? And she listed off four surgeons. And I felt in that moment very lucky that I felt like I had a pick of, excellent options, whereas I knew so many people who had been diagnosed a couple years before or 5 years before where surgery wasn't really an option yet as far as treatment plan for a stage 4 patient. So I think we've come a long way, and now it's just figuring out the right timing and all the different inputs that someone is considering.
Did you choose Dr. Long solely because his name was Dr. Long?
No,
Did you
no,
feel
I
like that
didn't.
added to his credibility?
I mean, of course. No, I looked at all the different doctors and sort of it just sort of was a happy kind of coincidence that I chose him and it felt right.
A great way to kind of like segue into our next few questions is that this is an individualized journey. And like for me, with being diagnosed over 5 years ago, my chart says I was terminal and it says my Tagrisso was palliative. There was nothing else offered. I begged for something else a year later, which they said, well, we could try radiation. Quite honestly, I led the webinar for Dr. Gay and Dr. Antonoff this past summer with Young Lung Cancer Initiative. And I even sat and listened to the entire thing, not thinking that I would qualify because I'd always been told if you had radiation, you would not qualify. And it wasn't until the very end of the webinar when another patient asked the question, I've been diagnosed 4 years ago. I had radiation. Would I qualify? And Dr. Antonoff said, I can't tell you for sure on this webinar, but I don't see why not. And I couldn't get off that webinar fast enough to tell my husband what I just heard because we'd always said, what can we do next? What can we do next? So this is just a testament to how fast things are changing in the lung cancer world. I think when we did that webinar, it really, I always told Dr. Antonoff, I was like, I'm sorry, you're probably getting more like patients than you ever cared to see because it just blew up. So I do think like Lexi had pointed that out too, from the fall to like, really like winter, even 24, 25, this just really has taken off. So, Ashley is the only one of us that's early stage and that was like her only option, whereas the rest of us had other options. So it is a different personalized journey for everyone. And like I said, I was almost 5 years out. Others were just months out to years. So Terri was a little bit longer as well. When you go for these consults and you have these consultations with these surgeons, and we could talk about this for days, but maybe if you would share, each of you share maybe like one question you feel is really important to ask of the physician, the surgeon that's doing the procedure. And it could be anything from your prior history and how that would affect things, the complication level, what to expect. Anything and everything's fair game. But what do you think is one really important question to ask the surgeon? Ashley, would you start?
Yeah, for me, I guess it was a little different because I knew I had to have the surgery. I didn't mention this previously, but I had no symptoms. I found my lung cancer incidentally because I had a random mass on my right chest wall. And so for a few weeks, they actually thought I had metastatic sarcoma. But when they biopsied it, that lump came back benign and the nodule in my lung came back as cancer. So my question to both the surgeons was, could you remove that chest wall mass? And one of the surgeons didn't want to remove the chest wall mass. She said it was benign and that I would have surgery on two sides and that would be hard to recover. But as you all know, we have to like weigh what's important to us. And I did not want this lump on my chest wall anymore. So I really appreciated that one. And similar to you, by the way, I said, well, the other guy can do it. And then she was like, well, I'll do it then too. So I think like pushing back in your question can sometimes be really important and actually get you an answer, because there was nothing wrong with doing that other incision at the same time, but it was a cost benefit. And I feel like some physicians aren't going to help you weigh that risk and give you the option. So I appreciated finding a surgeon that would take care of both in one surgery for me.
Mariah, how about you?
My recovery was awful. We'll discuss that later. But when I was recovering, I kept thinking that it was because of the talc pleurodesis and also the chemo that made it challenging. And I don't think at the time of consultation that I mentioned, is it going to complicate things? I was just like, I want the surgery, no matter what it takes. But I learned with my past appointment a few weeks ago with Dr. Antonoff that it was due to the location of the tumor, that was what was glued to my chest wall. And she said it was like peeling a balloon glued to cardboard. And I thought that it was due to the talc when I was first recovering and heard this. I thought that made it complicated. She said, no, it was the location. So it's kind of comforting that people who've had chemo talc, they can move forward with surgery. But at the same time, anybody could have a terrible recovery like I did because of all the nerve damage that became the surgery. It was to the point that Dr. Antonoff said that she probably shouldn't have gone forward with it. And her fellow that was assisting had tried to stop the surgery, but something in her said that I would want to move forward. And I'm so thankful. I'd go through all the pain all over again. But I think I would also clarify that no matter what, I do want to move forward, no matter how complex the surgery might become. But so location of the tumor, how it could complicate things is like the biggest thing that I didn't think to ask. I was all surgery, yes, that's all that matters. Decades and decades, okay. I'll be here.
Yeah, I think that a lot of times questions are hindsight's 2020. Like
Yes.
you didn't know to ask the question because you
Right.
didn't know. So hopefully people are watching this and learning from us.
Mm-hmm.
Terri, what's a question you think is an important question to ask?
It's really important to understand your surgeon's experience with these procedures. Had I stayed in Minnesota at the University of Minnesota, the surgeon there didn't have very much experience with stage 4 lung cancer surgeries. Had she agreed to have this done, it would have been an option for me to stay there. But I think it's really, really important to seek out a center of excellence and a surgeon that has vast experience with surgery and complicated surgery. I had a lot of complications after, not complications, but a lot of nerve damage, a lot of nerve pain because we were removing my pleural lining, which is not common and which is complicated. And it was also like peeling a balloon off of, like a melted balloon off of something. So it was a challenging surgery. And I'm so grateful that I had Dr. Serfolio performing it, or would have been great with having Dr. Antonoff perform it as well, because they both have so much experience with, stage 4 lung cancer patients. So I think it's important, if you are considering something like this, seek out second, third, fourth opinions and choose someone that you think is most capable to perform this surgery for you. And don't be afraid to ask for those additional opinions. Don't be afraid to push for what you need and what you want. It's your only life. So you got to take the best shot at what you think is going to give you extended health.
Yeah, I agree. Haley, what about you? What's a good question that you think of?
I think a good question, or kind of two, is why do you think I'm a good candidate for this surgery, and what's the actual goal of the surgery? So she was really big with like the complete metabolic response. Like, if you're going to do surgery, now is the time to do it. And she was like, my dream is to have this be a chronic disease, not a terminal like disease, which was a big deal to me because I have little kids. I also love that she was a mom and that was like her getting me safely out of surgery to be in the best shape possible for my kids was her goal as well as mine.
Great. That's great. Lexi, what about you?
For me, I wanted to know and understand what the margins were going to be. Like, were we going to get clear margins? Where, how, and even at the time, so I had a segmentectomy. And so they took the two upper segments of my upper left lobe. And we had, he said, I can take the least amount and have a centimeter of clear margins. I could take the whole lobe if you want. And I was sort of like, I don't know, and it's sort of on, and so we talked a lot about the pros and cons of doing it. And there seemed to be way more cons than there were, sort of like just take out what you need, but take out enough of what you need, to be sure that we are clear around it. And so that was sort of a lengthy conversation as far as how much to take and where to take it. And then we talked about incisions and like where that would be and things of that nature. The other thing that I'll say, which I did not expect from Dr. Lung, is I would send him a message on my chart and he would call me like a second later. And I thought that was unusual as far as interacting with the doctor. Look for someone who really is invested and who cares and you to feel comfortable. And I really felt that from him, with the way that he sort of took as much time as I needed with me to make sure that I was comfortable with what we were taking and where we were taking, and that he made sure to reach out to me, especially in some of my frantic messages.
Well, so these are all really great questions. I, on the other hand, didn't ask a ton of questions because I had sat there and led the webinar, so I felt like I had a lot of my questions answered to begin with. I will admit, though, I was told that diagnosis, well, eventually I was told that they thought I'd live 5 years, and I was approaching that 5 years, and I was like, well, we've got to do something. So my big question to her was, if you get in there and it's different than what you're expecting, worse or better, what will you do? And, that was just for me to know kind of like what was her plan, because until you really get in there, I didn't feel like anybody could really say, well, 100% we're going to do this. So that was kind of a general question, just to explain your plan to me. Like, what if it's all over it shouldn't have been, I had a PET scan, but what if you get in there and it's somewhere you didn't expect, or it's in a trickier spot. And I also had radiation, so I had a lot of scar tissue, which makes the surgery more difficult. So, and I knew that going into it. So I guess my one thing I would add is just to add that about what is your plan? How are you going to deal with this? When we're thinking about surgery, and, a lot of us have talked about like getting things taken care of at this certain sweet spot because you don't want it to advance. Obviously, that was not kind of my case, but a lot of you seem to have your trajectory of like what you're doing to take care of your cancer is happening very quickly. You're diagnosed, you're starting multiple treatments. Now you're looking at surgery. So is there anything that you did specifically to prepare your family for your surgery? And I'm not talking like meal trains and that kind of thing, but like what to expect, like how did you prepare your children that you were having surgery? We can't lift it much when we come home and you're sore. And so just kind of what kind of preparations did you do for other people that are in your life that are important? Terri, did you have any preparation? I know you had a little bit older of children, so they would be definitely aware that you were having surgery.
Kids were still all at home when I had surgery, and were they? Yeah, they were. Seems like a long time ago. I think we kept everything pretty top level with the kids. I didn't voice my serious concerns. I was pretty worried about removing the pleural lining because that seemed a little unique and additionally risky. My husband and I had a lot of conversations about this procedure versus that procedure and which one would be best. He kind of just said, this is your decision ultimately, and you've got to make it. And I have a higher level of risk, and from my perspective, I want to do everything I can to, ensure my health. So my husband and I had those conversations, and my kids and I never did. I mean, we just kind of said, this is what we're doing. This is what it probably will look like afterward. We didn't really voice my serious concerns with the kids.
Yeah, I think that's probably the majority of us. I mean, my kids are older, like Terry's. They knew I was having surgery, and we just made it sound like it was the best thing ever, and like there weren't going to be any problems. And we just had to stay positive. Now, some of you have younger children that are still at home and needing like physical care, like to be lifted or snuggled or whatnot. So, how did you all prepare your younger children for that?
I also tried to make it fun. My little guy is in a crib, so he got a ladder for his crib. So he loved his ladder. He was very sad when it went away, when my lifting restriction went away. But I was not sad that he couldn't get out of his crib anymore. And yeah, I told them people would be picking them up. They would get to ride with their friends to school. My oldest got to walk to school, which I had never done because of my job. So he walked with neighbors. So just really tried to prepare them that things were going to look different. But even though they were so young, they really did have concerns and worries about mom and her incisions. And they still see me put the scar tape on and ask if I'm okay and the band-aids. And it's very sweet and, hard.
Yes. Oh, yes. Little ones definitely pick up on it for sure.
Mine was kind of exciting because it was their first plane ride. They flew to MD Anderson with me at 2 and 4. And so they were distracted with family there, going to the museums, and they visited me once right after surgery in the hospital. But at home, my mom had a great idea connecting Madeline, the story, with her little appendix scar. And there's mommy's scar and there's her scar. But I can tell that my now 5-year-old, anytime I'm away, he thinks I'm at the doctor's, and it bothers him. I need to do some sort of counseling, I think. At the time, it was exciting, I guess, for them, but it was challenging not lifting and also all the pain that went with it. But yeah, so but at the time it was an exciting trip, but also it was, I didn't really prepare. My husband and I didn't really talk much, but as I was being wheeled in, I wasn't talking to my dad at the time, but I told my husband, I'm like, reach out to my dad, let him know I'm going into surgery. It was just that thought of like, I might not wake up type of thing. But other than that.
Thank you for sharing that. Haley, I think you were starting to say something maybe?
Yeah, my kids they're now 7 and 12. And so my 7-year-old, I think, had a harder time with everything than my 12-year-old, just not understanding. Like, he's my baby, so he likes to be carried up the stairs to put to his bed and whatnot. Ours was kind of different too, because we're in that very, like, we're going to do all the things we can possibly do. So I came home to 10 visitors at my house that were going to the PGA that was in Louisville that we had planned before we knew surgery was on the table. So we just try to, like, they would take them to do different activities and whatnot. But the only thing that I kind of regret is I came home with a chest tube because of a prolonged air leak, which I know is kind of different. I had a Plerex before that from December until surgery when they did the pleurodesis. But Everett was kind of scared that I was carrying around this drain, so I kind of wish I would have known about that ahead of time to kind of prepare him for that. But I think really my kids think that it was curative. And I'm okay with their ages right now. Like, we're just, yep, we got to go get checkups. We're not dwelling on the what ifs right now, which I think is helpful for my daughter, especially with having a hard time with trying to process everything.
Lexi, what about you?
Mine are 9, 6, and 4 now. And my youngest was 2 when I was first diagnosed. And since then, I've had lots of boo-boos, them. When from when I was first diagnosed, I couldn't put weight on my leg. I was on crutches. And then when I was on the different medications, I had the, paronychia and cuts down my fingers and on my hands and toes. And like, I feel like I've had for the past year and a half, or, I've had moms had boo-boos, and they sort of know at the different levels of their ages why or what it's from. My youngest doesn't know. But my middle knows a little bit more, and then my oldest, my 9-year-old, knows, understands most of it, of everything that's going on. And so they're sort of accustomed to having to be careful around me. Now, in the beginning, it was like a shock to my youngest system. Like it was really hard for him to not be able, for me to hold him. I couldn't stand and hold him. There was so much I couldn't do. And it's sort of, they understand, they learn, they realize, but then it sort of breaks my heart when, they're delicate around me. And I wish that wasn't the case, but
Yeah.
it has to be at times. They're really good about it.
Yeah, that's hard. Our spouses and our kids and our friends, and even because we're in the middle here, we're not children ourselves, but we're not older. We also have our parents to worry about too. Like, how is this going to affect my mom and dad? Do they understand? Can they be there? Will they be able to help? All the things. So this is it is something that you kind of have to prepare yourself for. I know some of us do acupuncture, massage, therapy, like even talk therapy prior to surgery to prepare ourselves, but we also have those other people in our lives that we have to prepare. We're going to try to wrap this up, but I know one question I always get is, what about the treatment that I'm on? Do I have to stop treatment prior to surgery? And I know we mentioned it a little bit through this. So I will just share, for those of us that are on Tagrisso, typically they tell you they'd like you off Tagrisso for 7 days prior to surgery. And that's kind of like the general rule of thumb. Dr. Antonoff has said 7 days. I know to all of her patients, that's what she says, a hard week. And so those of you that did not use Dr. Antonoff, that may have been on different treatments, or even Terri, I know, used a different surgeon, maybe, and Ashley doesn't have another treatment. So I guess really this is for Lexi and Terri. This question is, what about your treatment? Did you have to, when did you stop your treatment? Terri, would you like to go first?
Sure. I stopped 1 day before and 2 days after, so 3 days total off of Tagrisso. And that felt okay to me. When I was not taking Tagrisso, I felt a little anxious, but given I was doing the surgery, I'm like, okay, I can do this exchange. But yeah, 1 day before and 2 days after.
Hey, well, that was shorter. That's interesting because we were definitely all told a week. What about you, Lexi?
I was on chemo at the time, so I stopped 3 to 4 weeks prior. And then I had my first infusion 4 weeks after surgery. So that was 8 weeks total of being off of treatment. And that was really hard. It was really hard emotionally, anxiety inducing. And even though I knew that I was getting out the primary tumor, I kept thinking, I was like, of course I want this. I'm happy I'm doing this, but like, this is why they don't do surgery on stage 4 patients, because you don't know what's happening in the rest of your body. And that thought is really scary. And but the reality, at least for me, is I have oligometastatic disease. And so logically, I know that things won't grow and progress as quickly as that. But they did over last summer when my mass in my lung regrew. But it's sort of, it's really hard to be off of medication for that amount of time, even if you know it's worth it.
Right. We're kind of told how important it is to make sure you're doing your treatments. Then you think, oh, why am I stopping? So yes, totally agree there. Like I said, we're going to try to wrap this up because we have 2 exciting episodes coming up. This next one will be on kind of what is going on during surgery. And then our third will be about what about after surgery. So remember, like and follow us so that you can find those next 2 episodes, and you will be seeing all of our faces again shortly for that next episode. So thank you so much for tuning in today, and we look forward to next time. And thank you to all of my panel members for being here and helping with this. I think we're going to educate a lot of people out there.